Once inaugurated, President-elect Biden's administration will take over the coronavirus response, and it comes at a time in the pandemic. For more on that, let's bring in NBC News medical contributor Dr. Vin Gupta. Good morning to you.
Good morning, Chanel.
The numbers continue to go up. Coronavirus cases in the U.S. have now topped 24 million. It's kind of hard to conceptualize that, but President-elect Biden's incoming chief of staff is now warning that the U.S. will surpass 500,000 COVID deaths by the end of February. When do you think we'll start seeing the effects of the vaccine turn things around?
Chanel, it's going to be in that time period of March to April, we hope, presuming there's no hiccups in the vaccine distribution. We are expecting, these are projections from the Institute for Health Metrics, that approximately 570,000 souls will have been lost here in America by approximately May 1st. We do think vaccination, as it ramps up, will save about 40,000 lives during that period. And then by May 1st, hopefully we have some states reaching or at least approaching herd immunity, with about a third of Americans still susceptible at that point to the virus. So that's why it's still going to take well into the summer before we can say, really breathe a true sigh of relief. But if we're looking for signs when the vaccination is really going to start to bend the nature of this pandemic, where we can start to think about normalcy, we're going to look into that early May period where we're going to start to see things really shift.
And Dr. Gupta, let's talk about the Johnson & Johnson vaccine. It's certainly shown some promising signs, especially for the immune response. But what can you tell us about this vaccine? How does it stack up? How does it compare against the others?
Well, Dylan, what's interesting about this vaccine is it's a one-dose regimen. A few days ago, results were published on this vaccine in the New England Journal of Medicine showed that it was 90% effective in a group of individuals 18 to 55 years of age. And at about 70 days after the initial vaccine administration, that protection still was present at a very high level. They haven't tested past 70 days because the study's only been at the point in which they published the data. It had only been 70 days. That was the full time course of the study. So there's still more to be determined about duration of efficacy for this vaccine, just like with all the other vaccines. I will say that later this month, they're going to publish data on those individuals older than 65 years of age. So that's going to be an important piece of data to look out for. But we're really encouraged. Storage capabilities for Johnson & Johnson are much easier. You can actually store this in ambient temperatures for a period of time. And also, it's one dose. So we're really excited about this and these initial results.
Yeah.
Hey, Dr. Gupta, there's this new report out of Florida from the Department of Health, and it revealed that more than 43,000 people in that state are overdue for that second vaccine dose. And the reason why appears to still be unclear, but there have been some concerns about the side effects for that second dose, some concerns that the side effects for that dose may be a bit worse. What do you say to folks who might be worried?
Well, Craig, getting the second dose, actually, with all of you watching, I will say that in those initial 24 hours after that second dose, I did feel worsening body aches. I did feel injection site soreness, but they went away within 24 hours. So while you might feel a little bit more fatigued, you might have slightly worse body aches, it's nothing significant. It's nothing unusual relative to, say, how you might feel after a flu vaccine. So those side effects go away quickly, and ultimately they're mild. I have seen these reports, Craig, out of Florida that you're referencing. Again, to your point, it's unclear. Is this a reporting issue? Are people having difficulties getting appointments? We don't know yet, so I worry about speculating. But that second dose is absolutely vital because that's what the science says is key. 2 doses, in the case of Pfizer, 21 days apart, in the case of Moderna, 28 days apart, to ensure you have full efficacy and hopefully long duration of protection, but we're still figuring that piece out.
All right. Dr. Gupta, on this MLK Day, we know a lot of people have the day off or day of service, but I can see you're still working. So we certainly don't take it for granted that you give us your time in the morning. So thank you for talking with us today. Always solid.
Thanks for having me, as always.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.